I'm going to introduce you to our next speaker, who is already, I can see him. Hi, Rich. So, Rich, as our previous speaker, has a long career as a nurse and also feels the passion for cancer nursing. So, it's wonderful to have really passionate cancer nurses that have been working for a while, and despite compassion fatigue, they still feel that passion. So Rich has worked at the Bass Center for Childhood Cancer and Blood Diseases at Lucille Packard Children's Hospital for 30 years, working mainly as a clinical nurse specialist or a pediatric nurse practitioner. Rich also has done volunteer services both locally and abroad and has a number of awards that I'm not going to mention all, but show your spirit and how you want to keep inspiring and motivating other nurses. Rich and Jasmine, who is my co-chair today, are gonna have a conversation with us. So thank you very much, Rich, for joining us today. It's just a pleasure. So thank you.
It's an honor and a privilege. I was caught by surprise, and I'm very thankful that you invited me. So, would you like to ask the questions, or where shall we begin?
Well, thanks, Rich, for being here with us. For me, it's an honor, like, interview to you. And we will start with the questions. First, tell us how got involved in volunteering to go to Latin America to support nurses caring for children and adolescents with cancer.
My outreach work, particularly with respect to peds oncology, happened while I was going to graduate school for for my nurse practitioner and my clinical nurse specialist certification. It was my master's program, and during my tract through that, during my pathway, I got involved first with UCSF at University of California, San Francisco. We were doing global. We were doing the Guatemalan Health Project, and it was just a few years after the Guatemalan Civil War.
Mm-hmm.
The government was trying to reach out to all the people who were kind of hiding from the aggressions that were happening amongst the factions and just trying to get primary care to them. And they had developed a relationship with UCSF and the nurse practitioner
Mm-hmm.
students to go during the summer to provide primary care, identify people who had more complicated levels of care, and get them back into the fold for healthcare. Now, while I was involved with that work, I was introduced by somebody who was in the project to Julia Challenor, because once this lady spoke to me and she asked what my experience was, she found out that I was very experienced in pediatric oncology. I am bilingual, bicultural, Hispanic, and that's exactly what Julia Challenor was looking for. Now, to those of you who don't know Julia Challenor, but I venture a guess that everybody here knows Julia Challenor because she's a legend, and for me as well. But in any event, she was
Yes.
a professor at UCSF, among other things, and she was involved with a group called A Tomorrow for Children, and basically bringing resources for
Mm-hmm.
both children and for nurses in Latin America. And her particular project that she was involved with was opening up the doors to the first clinic in Guatemala City for pediatric oncology. And what she was looking for was a cadre, a group of nurses to go and instruct nurses in that clinic. And since I was going to be in Guatemala anyway, I was going to take a week extra for vacation. And then when I was introduced to her, she asked if I would use my vacation to do training and start establishing a relationship with some of the Guatemalan nurses and to conduct some classes basically in peds oncology. That's where the seeds lie for my. That's how I got involved And since then, my relationship with Julia has blossomed. She was my mentor. She not only helped me with that, but she helped me throughout my, especially towards the more difficult part of writing my big paper for my master's. She's been there for me for countless things, and she's involved me in countless countries throughout Latin America, and then she got me involved in India and in Ethiopia as well to do similar kinds of things. That's how I got started.
Wow, very interesting your experience in every countries. I think that Julia is a mentor for
All of
all.
us. What an
Yes,
angel of
yes.
mercy. I know. My relationship with Julia suddenly is a long time ago. It goes back 24 years now.
Wow. Well,
And
well, the next question is, what do you think are the key simil similarities between nurse caring in your hospital and the ones you see internationally?
That's easy. There's a passion that goes with caring for kids with cancer. Um, there's a parallel that is, I mean, when you just feel it from an emotional, spiritual standpoint, people are driven. Um, both in Latin America and in foreign countries, and as with the United States, they are highly intelligent in ways that I still can't imagine. And that's not hyperbole. I mean, my recognition and the things that have happened for me in nursing is really only because I'm persistent. It's not like I'm incredibly highly perceptive. I'm just persistent. And that's my gift. But I move slow. But the people with whom I've worked in Latin America and in the United States are both quick and persistent, and they just have talent in ways that it's phenomenal to me. In such a way that I'm always asking, how did you think about that? I mean, how did you come up with those really creative and wonderful ideas to bring these resources to bear under these circumstances? And those are also parallels. I wrote myself a few notes because you gave me these questions, and I want to make sure that I cover everything. But the
Okay.
long and the short of it is they provide really excellent care. And it's a joy to work with them. My first career was in the military, and one of the things that I missed when I got out of the military was camaraderie. And I have been able to to a great extent, recreate the camaraderie in peds oncology. Now, I miss the dudes and hanging out with just the guys because it's a female-dominated profession. But once I get over that piece, it's really awesome. I've had my downs, as with the lady who was speaking about resilience, and I've gotten thumped. Excuse me, I'm using slang, but I've gotten overwhelmed emotionally by certain aspects and burnout within the scope of doing peds oncology. But part of what lifted me up was also my colleagues who were there, and it was dynamic. I'd help them when they needed help, and likewise me. So, and I see that in Latin America too, as I've formed certain bonds with some of the people that I see all the time, some of whom work with you, Jasmine, or had worked with you, and that is Paula and Lorena.
Yes,
I mean, when I
yes,
did the
I know.
project in Chile for um, the APON chemo class.
Yes.
They were the wings beneath my wing, the wind beneath my wings for me and for Janie, who came down there. But I could go on and on and on. Shoot, we only have a few minutes.
Well,
And
I must just say the audience, I noted Rich when she come to Chile,
um,
and we made a iPhone, right?
that's correct.
For me, it's a really honor interview to you.
Well, thank you, Kylie. Se lo agradezco. Mira, lo siento que no estoy diciendo todo esto en español. Sorry, I'm speaking real quick Spanish here because I just wanted to convey something a little bit more personal. But basically, I'm saying thank you very much. Pues sigue con la próxima pregunta. Estoy listo.
Okay, and the next question, how do you see your international visits as make a difference?
Wow. How do I think they have made a difference? Well, if I was to be honest, part of it is completing the loop with you and knowing that, it's, the whole thing, the way this started was at first there was a knowledge deficit for nurses when I started originally in in Guatemala and some of the other countries, because so much of what nursing was 24 years ago, 25 years ago, was nurses were more administrative and logistical. They weren't providing direct care. And the clinical groups on the ground realized that if they were going to make pediatric oncology work, they were going to have to really start sharing some of the clinical responsibilities, particularly physicians, with the nurses, starting with how to assess a patient, tell, which ones looked, were truly sick versus which ones weren't so sick. Not only that, the nurses were going to have to administer care, in terms, because there was one time where the docs would diagnose and treat and administer all the medications and chemo and supportive care, and that's just not tenable. That's not possible. And they were going to have to share their wealth of knowledge with the nurses, and that's how I first got involved. What was especially remarkable in Latin America and watching things turn around was that those women were phenomenal knowledge sponges. They, first pass, I would teach these skills, they'd get it, they demonstrate it back, rock on, and they'd go on to the next thing, and they were just, they could really process, assimilate, and take care of the kids in short order, and loved doing it. So, it was very rewarding to see that aspect of it. And now, in terms of what is going on and how I've observed the changes and how, starting at one end and over the course of 24 years, how that's changed. Really, it's become a collaboration, because they've learned how to provide care with a fraction of the resources of what we have here in the United States. And now, when I say collaboration, I learn tricks from these folks to whom I've been, had trained all those years ago or more recently, and they teach me neat little skills that I can take back to the bedside, and share with my colleagues as well. I hope that answers your question.
Yes, of course, yes. Okay, the next question is, what do you think are the priorities of the nurse you collaborate with international?
It's whatever the nurse tells me it is, just before a given trip. And that is to say that before I go on a trip, if it's by myself or with a group, we'll do this. And that's to ask what are their needs and to listen deeply, especially in this day and age, whereas before, when there was a rudimentary, a very basic understanding as to how to provide care, oftentimes we had a pretty good idea as to what the priorities were in the early 2000s and getting certain clinics up on their feet. But nowadays, it's, as I was just saying with the previous question, the priorities involve asking what it is that their needs are, and listening deeply to what they want us to bring to bear, and making sure that we don't do this one down thing again, that it's a collaboration, that we provide what it is that they want and be flexible when we arrive there, knowing that sometimes things don't always get communicated in completely in the way that they would intend, being distant and even online or through emails, that something's going to change on the fly. That is to say, in the moment, and be ready to provide for whatever they're asking us for. Make sense?
Great. Yes, of course. Okay, the next question. What are the best practice you see internationally of nurses caring of children, adolescents with cancer?
It goes back to what I was just talking about. The one thing, especially when I go to low or middle income countries, that that just knocks me down, and it's not a slight, it's not me bad mouthing my colleagues up here, but when I go to Latin America or a low to middle income country, I'm always so impressed with how they can achieve the same level of, high level of care with these kids with cancer and get the same outcomes that we do with the kids in terms of keeping them safe and also in terms of long-term survival or outright cures, at least with the standard risk cancers, and even some of the weirder ones, as we do with a multitude of resources, and they do it seamlessly with less, not as good staffing, and they don't complain, because I get pretty whiny far sooner than some of the colleagues that I meet in Latin America. And then it's very humbling to see what they're doing with having to take care of more patients with less supplies, as a for instance. And that is singularly the best practice with nursing care that I see with these nurses. And they don't, and it's without sacrificing a quality of care for those kids. And I like it because that's also what keeps me impassioned when I come back home. It's like I'm thankful I've got the resources, but it makes it so that I can drive on a night that is particularly difficult. So that's what.
That's we can see is still exist difference difference yes. Well, the next question, and finally, is there anything else you would like to share with the audience?
If I was to share anything, it would be gratitude. First and foremost, again, thank you for letting me speak. On a broader level, I have so many people who I would offer said gratitude to in terms of people who you might not know who got me involved in advanced care in pediatrics as a clinical nurse specialist, and to a lesser extent as a nurse practitioner. I didn't do that as much as except on a couple of occasions. I did more the clinical nurse specialist, but more so with Julia Challenor, who had started as my mentor and is also my friend and mentor constantly, and has enhanced my professional trajectory in ways that I will never be able to repay her from a gratitude standpoint. Now, I bring all this up also because for those of you watching who don't have as much experience, if you can find the equivalent of somebody like Julia in your corner of the world in the hospital, somebody like that is invaluable. And I know that in my own practice, I served that way to a number of people at my hospital in terms of the younger nurses who first are getting established in clinical practice specific to pediatric oncology, and those who are starting to do more and more, reaching out for extracurricular like global outreach or other things outside of the hospital. But just mainly gratitude, and thank you for letting me speak. That's really all that I would want to share with that I can think of. Do you
Thanks
have
to
any more
you,
questions?
Rich. Thanks so much.
You're most welcome.
Rich, there are people also showing admiration for you. So we have a comment from Shirley Bem saying that
Oh,
she doesn't have a question, but she admires you so much and the work that you have done. So you are being the Julia Challenger for someone else.
I get that, but I also wanted to let people know that there's, it's a dynamic process. You, there's always going to be somebody who supports you, but you want to return the favor to the people who are coming up behind you. And to be honest, my days are numbered as a nurse. As of February 2nd, every day is going to be a Saturday for me. I retire. I will
Oh,
still continue to do global outreach. I will still continue to teach the chemo classes at Stanford. And I also run support group for the Latino families with children with cancer here in California. And so, I'll stay alive within the profession, but the bedside thing will come to a close.
but you will keep inspiring people that are gonna be at the bedside and patients that
I see
actually
that.
need it. So thank you so much. Um,
And I'm going to totally agree with you on that. Jasmine, mil gracias por por invitarme y haberme dejado, pues, charlar con ustedes, ¿ok? Y pues sé que tal vez hubiera sido un poquito más fácil hacer esto en español, pero después de charlar con Julia, ella me había dicho que tal vez para el resto de la gente sería un poquito más fácil charlar en inglés. Pero, thank you, thank you, thank you.
Muchas gracias a ti, Rich, por estar con nosotros. Yo he aprendido mucho de ti, Rich, desde que te conocí. Y para mí, cuando Julia me dijo que usted venía, yo feliz de poder entrevistarlo y estar con usted y aprender y seguir aprendiendo de su experiencia, por supuesto.
Chévere, chévere.
I really enjoy your
Okay.
conversation. I think it's nice to have different ways in a conference. We are having some videos, some live presentations, and this very nice and inspiring conversation of very humbling, but also very inspiring person. So thank you, Rich, for joining us today.
You're most welcome. God bless you all, and thanks again. Until we meet again, take care. I actually have to get ready and go to bed because I work tonight.